Appreciate it.
So the vaccine is already on the Georgia coast. This video shows you how Grady Hospital plans to store it when it arrives here. I talked to Pouria Sanae. He is the CEO of ixlayer about this last mile of vaccination. Pouria, walk us through how this vaccine is going to be transported. How do we get it from the factory to hospitals and health departments across Georgia?
There are many steps in the transformation, and we're still figuring out depending on the vaccine type. I think the challenge and the thing we focus mostly on is what happens after the transition when it reaches the vaccination centers. What then? This is what we call the last mile of the vaccination, and that's really what ixlayer focus areas are. Prior to that, there will be McKesson, there will be distributors, FedEx, UPS. But the issue is the last mile of the vaccination.
What are your concerns about that last mile? Keeping it cold enough, how it's stored? Walk us through that.
No, there is 3 different steps once it hits the vaccine center. The question, first of all, is where is these vaccine centers? Are we talking about drive-through vaccination or in-clinic vaccination? The second one is the vaccination event itself. Patient shows up, gets vaccinated. We need to scan these vaccines, make sure recorded, reported back to VTrack. And then there is post-vaccination, following up with the patient on a daily basis. Their symptoms. Do they have any side effects? Now, after you've gone through all of that, how do we get that patient back to do the second dose? And that whole chain after delivery is what ixlayer focuses on.
And that is a big question people are wondering, because now when you start hearing about allergic reactions that may make people a little concerned, they may not go back for the second dose. Is there anything that you think doctors and healthcare workers can be doing now or even lawmakers can do now to make sure that folks go back?
I mean, it needs to start on top. The vaccine events, the information needs to be reported back to VTrack. We work with virtual physicians, where if there is a patient that reports a symptom, it gets flagged to them immediately so they can contact that individual.
George, of course, as more people get vaccinated, people are going to start feeling better about